I'm really excited to be here today with Dan Sullivan. We had the chance to collaborate earlier this year on a webinar where we addressed risk management issues in the ambulatory setting and kind of the fallout of some of that, or I guess maybe the contributing factors of where failure to diagnose in medicine can really contribute to medical errors. So Dan and I find that we have a nice synergy between the products that we can offer at Sedgwick and both at the Sullivan Group to really mitigate some of the risks that we're finding in the work that we do. From my perspective, when we had our webinar, I got to speak about what the work that I'm doing in physician practices. And as I say to folks, it's kind of like being in the rodeo. But we do identify we have some top 10 areas of risk, I'd say, that I really focus on when I go there. Part of that is teamwork and communication. Part of that is really looking at systems and processes that are in place in a physician practice to prevent error. And I look at medication safety, emergency management processes, things like that. So I find that there's a lot of opportunity in that environment. And I know that when we identify specific areas of risk, I know that the systems and solutions that the Sullivan Group can offer really help our clients take their risk management program to the next level. And I think Dan could speak to that a little bit, and we'll chat.
Yes, and I will. Thanks first for the opportunity to work together with Sedgwick. Really flattered to be a part of the team, and I know that you have a lot of exposure out there in the ambulatory world, and it's kind of a setup for identifying what the big issues are in the ambulatory world. Primary care, the huge issue is the failure to diagnose, and you put your finger on that, and communicate those issues to us. And then we have tools and resources to help practitioners to avoid medical errors, improve patient safety, and reduce the failure to diagnose. So we know from 20,000 feet is the failure to diagnose, and what we've been able to do over the years is identify the specific causes for the failure to diagnose and to implement tools and solutions that get built into the environment of the clinic, of the emergency department, you name it, so that we can improve the quality of care and reproduce quality with every single patient, reduce medical errors, improve patient safety, and reduce the failure to diagnose.
Dan, I think what's really pretty critical around this area is the IOM report that just came out about 3 weeks ago on the issues around failures in diagnosis. And I think that report, if anybody has the opportunity to review the summary of it, really highlights the 10 or 12 areas that we need to focus on to improve diagnosis in medicine. And that really just supports the work that you all are doing.
Right. And it's only 367 pages.
Right.
It's a quick read. And I think you probably, as I did when I read it, was not surprised at the conclusion that the problem is the failure to diagnose. Mm-hmm. What's nice about the IOM report is that it will charge the medical world with efforts focused on the underlying causes and elevate everyone in quality, use of evidence-based medicine, including the patient in the conversation, and hopefully getting us far ahead in this world of failure to diagnose.
And I think one last thing to add that is great for certainly those who are active in the risk management field is ASHRM does have a seat at the table for the Coalition to Improve Diagnosis in Medicine, and we've worked closely with the Society to Improve Diagnosis in Medicine. So we look forward to advancing the cause and supporting the work that the Sullivan Group does as well.